Well, up first, let's get you the latest numbers that have been released in India, and 72,049 fresh cases and 986 deaths have taken place in the last 24 hours, a rise from yesterday's 61,267 cases. Now, 82,203 have recovered in the last 24 hours. So currently, as you can see there, India's total number of cases stand at 67,57,131. The total active cases are 9,07,883, and the total number of deaths that have taken place is 1,04,555. Now, the 5 states which have reported the highest number of cases and deaths in the last 24 hours. If we talk about the cases, it's Maharashtra with over 12,000 cases being reported in the last 24 hours, followed by Karnataka, Kerala, Andhra Pradesh, and Tamil Nadu. So there you can see in the south the cases increasing. If we talk about the number of deaths, again the list is topped by Maharashtra with 370 deaths, then Karnataka, Tamil Nadu, West Bengal and Uttar Pradesh with 61 deaths. The world rankings in terms of total number of cases, USA is still at the top of that list with over 74 lakh cases, nearly 75 lakh cases there. India with 67,57,131 cases, followed by Brazil, Russia and then Colombia. Well, time now for our newsmaker today, and we're joined by Dr. Amitava Banerjee, Associate Professor in Clinical Data Science and Honorary Consultant Cardiologist, Institute of Health Informatics, University College of London. Thank you so much, Doctor, for joining us. Now, you've been a part of various studies on coronavirus, the impact that it's having, and most recently the study, and you've talked about this in a paper as well, the double burden of the COVID pandemic and excess deaths that are taking place. So firstly, explain to us these excess deaths. Why are they happening and what can be done?
Thank you. Good morning from London and good afternoon to you in India. So coronavirus directly has an impact via infection and in severe cases can lead to death, but also indirectly coronavirus has an impact on people either by changing their behavior, so it might mean that they don't seek medical attention for their other conditions such as heart disease or cancer and so on, or it can also lead to a huge burden on the health system and the health services such that the health service itself can't offer those other non-COVID healthcare services. So we talk about both a direct and an indirect burden of mortality.
And you, in your paper, you actually say that in many countries, it's been found that the number of deaths taking place, and these are non-COVID deaths, are much higher than deaths that have taken place during previous years. If you could tell us a bit more about these findings.
So that's right. It could be the case. One of the problems is that we're all obviously focused on coronavirus and doing our best to monitor and gather data about coronavirus cases and deaths, but we also need to keep an eye and monitor the non-COVID mortality, whether it's cardiovascular, whether it's cancer, whether it's other causes, whether it's other infectious disease causes as we enter winter months around the world. And so if we don't keep an eye on those, then what we found, for example, in the UK, is that there has been between a 50 to 80% reduction in the peak of the pandemic in services for heart disease or services for cancer. And that can have an impact on diagnosis and treatment of those other diseases, which could at worst lead to extra deaths. So we need to try and keep infection rates as low as we can everywhere, not just to avoid coronavirus deaths, but to avoid the non-coronavirus deaths too.
All right. So, Doctor, what can authorities do? What can countries do to counter this? On one hand, we're talking about COVID and we're talking about restrictions, asking people to limit the kind of outings and, their exposure to the public. But at the same time, we don't want them to take chances with their health. If they're feeling at the onset of a heart attack, they must rush to the hospital. If they need to get a cancer check done or go in for chemotherapy, they must get that done. So what do you think can be done by authorities?
So, first of all, we need to have a clear message to members of the public that if you have urgent healthcare needs, regardless of whether it's COVID or non-COVID, then you do need to seek medical attention. So, for example, if you have chest pain, then nothing has changed. You still need to be seen as urgently as possible. The second thing is that the most consistent predictor of bad outcomes with coronavirus infection is underlying disease and age. And so if you know that you have diabetes, high blood pressure, cardiovascular disease, lung disease, then make sure that you are taking your treatments and getting access to those treatments, even during these difficult times of lockdown, because that also indirectly reduces your risk from coronavirus infection as well. And finally, I'm sure it's the case in India and as in the UK and other countries in the world, health professionals are doing their best to keep those services open and trying to reassure their patients that we are open for non-COVID services as well as COVID services.
All right. And what is your opinion on lockdowns and restrictions? Because even now we see a lot of debate around, imposing of lockdowns, the impact that they cause on the public, the costs that they take on the public, but at the same time, how they help in, helping health services prepare better. So what is your opinion on lockdown? Because now we're seeing a lot of restrictions coming back in Europe.
That's right. So the evidence is clear. If you look across all countries, that there have been several cross-country analyses done that the countries that locked down early and had stringent measures kept their cases down, they kept their non-COVID deaths down, and they kept the effect on the economy down. The countries that did not have had a prolonged impact of the pandemic. So firstly, I would say this dichotomy between economy versus public health is false. There's no situation where having a low coronavirus infection rate is bad. It's good for coronavirus cases and deaths, it's good for non-COVID cases, and it's good for the economy. So that's number one. And keeping the infection rate down is whether you're in India or in the UK or in China, it doesn't matter. It's the same guidance of testing, tracing and isolating. Where we're doing that well around the world, then we're managing to control things. So rather than having stop-start lockdowns, it seems to me that the best solution is to get on top of the infection rate and try and keep it as low as possible, rather than some ideas that have been promoted of trying to live with an infection rate that's higher. I don't think that's tenable.
Well, here in India, we do have a very high infection rate, and the numbers are increasing every day. But again, and finally, as far as the public goes, basically follow those rules that have been laid out by the WHO, and our government's also pushing wear masks, social distancing, and limiting your public exposure.
That's right. There's obviously lots of investigation research going on in different types of technology, but a lot of the management of the pandemic is long-standing, simple public health measures, which you just outlined there. So, first of all, the people who are at risk with underlying conditions and who have risk factors and are elderly, they need to be as protected as possible. It's upon all of us to try and reduce the infection rate by whether it's mask wearing, social distancing, thinking about working from home, and so on. And that is what's keeping the infection rate down in countries that have managed this.
All right, Dr. Amitava Banerjee, thank you so much for speaking to us here at NDTV.
Thank you.